So we know you're passionate, but what's so hard about digital health, and what's different, and what do these guys and all the people in the audience need to know?
Yeah, I think the interesting thing is, I've never talked to Halle about this, but I've always wanted to. I think that what I see is that when you look at the marketplace, there's a lot of carnage. So there's a lot of apps out there, and there's a lot of innovative ideas, and they get a little bit of funding, but they never seem to get off the ground, and why is that? And there's three core problems I see is, like, if you need to get to doctors, where's the de facto place you go and find a doctor online? Same thing with patients. Where can you do that? Same thing with data to drive that application. If you have a consumer app like Snapchat, you can integrate to the Facebook API and get to an abundance of the audience, or Twitter. So consumers are aggregated and rolled up in one place. But if you need to reach a patient with, name a chronic condition, diabetes, et cetera, you can't do that today, and that's one of the challenges, and that's candidly what we're trying to solve. But I think that we didn't have that foresight up front, and I think that most entrepreneurs that are going at it don't, and the cost of acquisition on a doctor, for example, generally is much higher, in some cases 10 or 15x than they're anticipating on paying, and that's incredibly challenging to run a business on.
Yeah. What do you think, Mike?
Well, in our case, I think just the nature of the problem that we're trying to solve is really hard. Getting people to change their behavior is hard. I mean, take smoking as an example. People know that smoking will kill you, and they still do it, right? I think that's been kind of the most frustrating thing for us. I think, we've talked to a lot of researchers who've been working in this field literally for decades, and it's been an incredibly tough problem to crack. I think that's what gets us excited about the explosion of data that's available and technologies that are available. There's so many new enabling technologies that are coming out that we really have started to see some much more impactful solutions on this problem, which again, that's what we get excited about.
Cool. So Halle, you screen, I think we're up to 450, 500 applications
over 2,000 now, so total.
Wow.
Total, but like per class, and I know we're part of like this laborious process. It's actually fun to look at all these wonderful applications that all of you put together. We watch all of your videos, every minute of it, I promise. Anyway.
Inside voice, Beth. Inside voice. I had the coach her on this in board meetings all the time.
I know. It's really bad. Okay, so Halle, you see a lot of apps and and a lot of just different things. But how do these become businesses? And what do you advise people? And how do you take an app for this, an app for that, and build companies in this space?
That's a good question. We've helped build some really interesting businesses over the past couple of years. Our team really leans on our partners, including you, Beth, including our partners at Qualcomm and the various stakeholders in the healthcare system, because they're able to look at the application through the lens of a customer. And so when we get their input on an idea, on a business, it's easier. We can say, oh yeah, a health insurance plan would love to buy that, but if we put it in front of United, they're going to tell us if they would buy that. So having the expertise in the space and having the stakeholders with us helping to screen the applications really helps us get a good idea of what is actually viable. Also, we're starting to see a lot of companies come to us that actually have customers already, and having that sort of validation really helps to understand if not only there's a market out there, but is this a team that can actually sell?
So what should they do?
So what should
Come
they
to
do?
apply for Rock Health.
Yes.